Good afternoon and welcome to Let's Chat with Dr. Celeste, MD. I'm your host, Dr. Celeste Reese-Willis. I'm your board-certified family medicine physician. I help busy professionals to find solutions for their acute and chronic medical needs through my concierge medicine program, telemedicine program, COVID-19 treatment, national speaking, as well as my brand new Amazon best-selling book, Vitality. Welcome, ladies and gentlemen, to Let's Chat. We have a very special guest that's here today. I'm so excited to have my mogul sister, Dr. Mia Cowan, in the house.
What's up? How y'all doing today?
And she's going to be talking to us, ladies and gentlemen, about keeping the V-flower healthy. So just my little 2 cents before we get started. This is not a kid-friendly discussion. So if there are any kids in the room, I know that we normally don't talk about women's issues on Let's Chat with Dr. Celeste. We talk about a variety of health issues. But this month, we're focusing on celebrating women for a variety of reasons. One of the main reasons is I know that a lot of women are having challenges adjusting right now to what's going on with both the pandemics and the civil unrest that's going on in the country right now and having a challenging time. So I thought what would be great is to highlight some health concerns that could be helpful for women and having some special episodes that are non-COVID-19 related that could help women with varying health issues. And so today we have our expert in the house, Dr. Mia Cowan, who is our B3 specialist. She's going to share with you who she is and all of her accolades before we get started. Dr. Mia, thank you so much for coming on for us today.
Thank you for having me, Dr. Celeste. So yes, y'all, I am Dr. Mia, your B3 specialist and board certified gynecologist. I help women suffering with weight gain, fatigue, and sexual dissatisfaction, and also men, but since I'm talking to the women, we're going to focus on that. So even if your husbands have a problem, holler at your girl. My focus is to help you live your best life with my cutting edge medicine, my books, my blogs, my Facebook Lives. I have a couple Facebook shows, Weekly Wellness with Dr. Mia, that comes on the second and fourth Saturday of each month, as well as Ageless Intimacy, which is the second and fourth Sunday of each month. And I do that with my husband, Joseph, and we also incorporate male intimacy solutions as well. So I am excited to be here. Thank you so much for having me. And let's get this conversation started, Dr. Celeste.
Okay, let's get the conversation going. So guys, you heard that Dr. Mia just alluded to the fact that she does do men's hormone health as well. And so men, we have not forgotten about you. Dr. Mia is going to come back and see us in October when we celebrate men. So let's just go ahead and break everything down. So ladies and gentlemen, remember, kids, this is not a kid-friendly discussion. So let's have all kids exit the room before you get started. So today's topic is keeping the V-flower healthy. So the first thing is, what is the V-flower?
So we have to say V-flower because we're on Facebook and we have to use appropriate words. Right. Some people call it the vajayjay. We're going to call it the V-flower, your girl part today, just to be safe.
Okay. So we know what the V-flower is. So that's just in case people are wondering, so what is this V-flower thing? So let's just start off, Dr. Mia, that one of the most common questions I get in servicing patients in primary care has to do with the soap. Let's talk about the soap and bacterial vaginosis and why it is. I know that Dove soap is what we typically recommend that women use. Can you share with us, Dr. Mia, the myths behind Dove soap and why you recommend it as being one of the best things to use in decreasing likelihood of bacterial vaginosis?
Yes. So with bacterial vaginosis, it's really a change in your pH of the V-flower. Okay. So when your pH in the V-flower changes, that's when you get overgrowth of the wrong bacteria. And that's when we diagnose it as bacterial vaginosis, which is not a sexually transmitted infection. It is really more so associated with pH, though women who are active are more commonly getting BV versus women who are not active. But what I recommend, so I get women who come in all the time, they're like, I have this chronic BV or bacterial vaginosis. And I'm like, really, what kind of soap are you using? So over the last years and, decade and a half that I've been practicing gynecology, I did notice that women were coming back and they were getting it over and over and over again. And so what I started to realize is that those women who were using like the body washes, not using just the plain soap, using all the smell good products, even those products that are meant specifically for V-flower cleansing can cause bacteria vaginosis. So what I have found is to keep my ladies from having to come in over and over and over. And it's frustrating because with BV, the symptoms are that funny discharge. It's a funny color. It can cause irritation. It can even cause spotting after intercourse. It can cause that foul smelling discharge, and it can cause some cramping and pain. So I've had women to come in, they're like, I'm having all this cramping. I'm concerned that they may have a real infection, but really they just have bacteria vaginosis, and it's coming from them using the wrong soap. So the 3 things that I have found that are safe to use on the vaginal tissue that do not increase the risk of BV include Dove. They should pay me for this, but I'm just going to go ahead and put them out there. Dove White Bar for the sensitive skin, which has to be a bar, not the wash. So bar soap that says Dove Sensitive in the white and green box, or Dove the original in the white and blue box. You can't go get the pink Dove soap. You can't go get the one with the exfoliation for your vagina. Now, V-flower. Now, it doesn't mean that you can't use other things on the rest of your body. So I also recommend that you have a separate washcloth that you use specifically for your V-flower, where you can use that Dove soap, the bar, to cleanse. And then the other 2 things include baby hypoallergenic wipes, as well as organic coconut oil. So baby hypoallergenic wipes for cleansing in between. A lot of women don't want to feel fresh when they go to the restroom, and they're using all of these wipes with the smell good stuff. They're using pads and they're using tampons with the smell good stuff. As long as your V-flower is healthy, you will not have a funny odor. Now, if you sweat, you get an odor, but you won't get that fishy odor or that foul smelling odor unless there is an infection. So by staying with the Dove White Bar soap, using a separate washcloth, using the baby hypoallergenic wipes, and then when you do need a lubricant, which we're going to talk about that later, why you shouldn't need a lubricant and things I can do so you don't have to break intercourse and go get a lubricant to make it work. You also can use that organic coconut oil during intercourse, and some of the other lubricants can cause a change in pH. So Dove White Bar soap is safe. Baby hypoallergenic wipes, safe. And then organic coconut oil during intercourse for a lubricant rarely change the pH where you're getting chronic bacteria vaginosis.
Okay, awesome. Thank you so much, Dr. Mia. And I will make sure that I make a note of that about the organic coconut oil, because you said that that's good to use as a lubricant as well.
As a lubricant.
Okay.
But our goal is not to have to use a lubricant. So with proper V-flower treatment and prevention, we can prevent having to use a lubricant as we continue to mature in age.
Correct. So that actually segues into our next question, which is about vaginal dryness. I know we hear a lot about vaginal dryness in women that are 45 years old and older, but there is such a thing. I actually got the opportunity to attend one of Dr. Mia's events last December, Ageless Intimacy. And during that talk, it was an awesome, awesome, awesome event. And I know that she has another one coming up post-COVID that I would encourage people to attend. Some of the things that you talked about in terms of vaginal dryness in someone as young as 20 years old. Can you share with us, Dr. Mia, about vaginal dryness in your 20s? Like, what are some of the most common causes, and as well as some solutions for that?
Great, thank you. So vaginal dryness, so that means that during intercourse, you may have some discomfort, you may have irritation after intercourse, you just may notice more dryness even with wiping, which is what can happen as you continue to mature in age and you're truly postmenopausal. So for my younger women that are on birth control, that's the thing we forget about. If you're on hormonal contraception, that can definitely cause more vaginal dryness, because the way that it works is it actually suppresses your estrogen in the V-flower tissue. And by suppressing the estrogen, that's going to cause thinning of the tissue, as well as dryness and sometimes irritation. So what I have my ladies to do so that they're not having to use the organic coconut oil during intercourse or stopping intercourse and messing up the moment is to just start treating the tissue early. So for my younger women, if they're having that issue because they're on hormonal birth control and we ruled everything else out, now we want to make sure that whenever it's vaginal dryness that we rule out any kind of infection, because yeast can act like that, bacterial vaginosis can act like that, as well as low estrogen. So there are some other things that we can use besides estrogen, including hyaluronic acid that you could put topically meaning place it in the V flour twice a week. And you do that at night right before you're going to bed. And that's going to maintain that tissue, keep it young and healthy. And my recommendation, Dr. Celeste, is to make sure that you are treating your V flour like you treat your face. So just like at an early age, you want to start wearing your sunscreen. You want to start doing some things to keep the wrinkles away, to keep the moisture in it. That's the same thing you want to do with that V flour tissue. You want to prevent a problem before it starts. So with the hyaluronic acid, which is a great product that we have and that we recommend to a lot of patients, is not my product. It's another company's product. It's actually called Reverie, and that is something that you can place. It does not need a prescription, and my ladies can use that twice a week for prevention. And I really like that for my younger women. As my women are maturing and getting a little bit older, and for my women who are on chronic hormonal birth control, actually adding the hyaluronic acid as well as the topical estrogen, meaning putting it in the V flour as well, and kind of alternating those work really well to maintain healthy, thick, lubricated, orgasmic vaginal tissue.
Okay, you all heard it. She said that helps to create healthy, thick, orgasmic vaginal tissue.
Yes, and lubricated is lubricated like when you were in your 20s and you never even thought about it. We want to keep it lubricated. And if it does not do that on its own, we want to make sure that we're preventing a problem in the future. Because right now, for my younger women, it doesn't seem like a big deal. They can just put on a little lubricant. But again, we got to treat it like our face. So we want to do prevention for our face. So you want to start that prevention very early with your V flour tissue, because I get those older women who have never done anything for their tissue. And not only is it affecting their intimacy, because it's not just intimacy, it also increases the risk of urinary tract infections, and then it causes the discomfort during intercourse, and then it can cause just plain discomfort in general if there's a significant dryness, even with wiping, just going to the bathroom.
Right, correct. Okay, so you heard what Dr. Mia said. She said we have to treat our vaginal tissue like it's our face. And so in terms of moisturizing, cleansing, and making sure that it's the most healthy tissue as possible. So we definitely want to do that. That's a very good analogy. Thank you for that, Dr. Mia, in terms of comparing, hey, you want to treat it like it's your face. And I'll share with you, I know that Dr. Mia is very open about sharing that one of the reasons why she focuses so much on V-flower health is because God made us, and he made us with that body part, and that he wants us to have healthy sex lives. I know that you talk about that all the time, Dr. Mia. Do you not?
Yes, the gift from God. The gift from God is one of our few gifts so that we can enjoy intimacy and pleasure that is inclusive of our V flower when possible. So that can be with your partner and without your partner. So we want to make sure that we're maintaining a healthy tissue. And again, it's not just for intimacy, it's also for prevention. Because as women get older and they're postmenopausal, then they can start having problems with the vaginal tissue being so weak that it allows the bladder to start to fall down, which can worsen incontinence and leakage of urine. The rectum can start to fall in. And so that causes what we call prolapse. So when women are saying, you know, my uterus and cervix are starting to fall out of my V flower, or my bladder is falling low, so it's harder for me to completely empty during urination, or it's hard for me to actually completely empty when I'm having a bowel movement. All of those things come from weak tissue in the V flower. You know, so to maintain a healthy tissue, we want to use our topical options, but we also want to make sure we're maintaining our healthy pelvic floor muscles. So the floor muscles of your pelvis, which we all forget about, but they make a huge difference in your enjoyment of intercourse, but also not leaking urine with coughing, sneezing, jumping, laughing. And that can start really early. And a lot of people think, well, that's not really a big deal, just put on a pad. But as you continue to mature, if you never fix that tissue, it can really affect your quality of life. It can affect, you know, just your feeling of cleanliness. It can affect women from even going out of the house because they don't want to have to put on a pad, and they don't want to be worried about actually wetting their underwear as adults, because it's a huge, you know, play in the quality of life, and is not a good thing. So not only is it not a good thing for intimacy and your quality of life, but even as you age, women who can maintain continence or not leak urine are more likely to be able to live alone longer because women who are having that incontinence, especially as they become more immobile and they're not able to get around as much, not able to get up to the bathroom as much, it's going to affect whether they're living at home versus living in assisted care or living in a nursing home. So it's important to prevent these problems before they start. And that's why I also recommend my ladies in their early 40s, go ahead and start treating that tissue before it's a problem. If you're not having a problem and you think everything is all good, you're well lubricated, this is the time to go ahead and start treating that tissue. If you're earlier than 40, starting to already have symptoms of leakage of urine with coughing, sneezing, jumping, laughing, starting to have pain with intercourse or discomfort with the dryness, and then, just starting to have more urinary tract infections, that's a sign that it's time to treat that tissue so that we can keep it healthy and functional.
Okay. Thank you so much, Dr. Mia. You guys, you heard it. Her genius about how and why we need to focus on keeping the V-flower healthy, long before we reach the age of being 45 years old. So, and you actually alluded to our next question, Dr. Mia, talking about the muscles of the vaginal area.
Yes, so those pelvic floor muscles are so important, and we forget how important they are. And a lot of women tend to know about Kegel exercises, which is when you're actually using the muscles of the V-flower and you're contracting them and controlling them. Well, that helps with leakage of urine. That also decreases your risk of the prolapse that we just talked about. But it also improves your intimacy, because if you can control those muscles yourself, then during intimacy, it makes a big difference in your enjoyment, especially that climax enjoyment. So being able to control those muscles, start off with the Kegels. If you're really young, do your Kegels every time you're at a traffic light. And when you're doing that, what you're doing is you are tightening those muscles, and you're not using your core, you're not using your abdomen, you're not using anything but those muscles of the V-flower, which are really your pelvic floor muscles. But that is going to help keep your vaginal tissue nice and healthy. But those pelvic floor muscles are going to be huge, not just for intimacy, not just for incontinence, but for your overall health and your mobility, and even just plain old balance. It's going to be huge for that as we continue to age.
Okay, awesome, Dr. Mia. So one last question. Does exercise play a role with V-flower health outside of the Kegel exercises?
Yes, and that's why I like Pilates a lot. Pilates and yoga, those are going to be my two top favorites for actually strengthening those pelvic floor muscles. And if you get a great Pilates instructor, which we have a great one right here in Birmingham, Alabama, shout out to Ainsley, you are going to want to go to those classes, start early, and it's going to give you more control of those important muscles that help us with our continence, meaning not leaking urine, as well as our intimacy. And y'all know that intimacy to me is so important because it's such a huge part of your total wellness. Women who have regular intimacy tend to live 5 years longer than women who don't.
Wow.
It also decreases your risk of a heart attack, and it also decreases your risk of a recurrent heart attack, and it helps with your mood. It helps with your energy. You get endorphins from intimacy that you can't get from doing anything else. It's these special endorphins you get from intimacy, which is why we need to allow ourselves to enjoy it, whether we're with a partner or whether we're doing it alone. It's fine. Just use your gift that God gave you. Enjoy that intimacy to improve your total wellness. It's a huge component of total wellness.
Okay. So Dr. Mia, you actually just alluded to something. I have a question. It's not something that we talked about before.
Okay.
But you said that having a regular sexually active lifestyle decreases your risk of coronary disease and other chronic diseases by 5 years, correct?
Yes. So women who have regular intimacy live 5 years longer than women who don't.
Okay. So does it matter, because you alluded to whether you're having sex with your partner or whether you're having sex by yourself? Does the orgasm matter? Can you talk about that?
Orgasm is an orgasm. And when you have an orgasm, whether it's with the partner or without, you're going to release those endorphins that are going to help with your heart, that are going to help with your energy, that are going to help with your mood. Like, you're so much happier. And that's my goal, is to make this world happier. We're going through some tough times, y'all.
Right.
Y'all at home, you're stuck at home with your family, you're stuck at home with your husband, or you may be stuck at home alone. but it doesn't mean we can't continue to enjoy that gift. And now that we have more time to do that, and another thing that we won't talk about this time, Dr. Celeste, but another big conversation is whether women are having that climax. And there are a huge number of women who, one, have never had a real orgasm, and there are a huge number of women who don't have them frequently enough. Well, one of the ways to figure out how your body works is for you to get comfortable with your body alone. And then when you're with your partner, you know exactly what you need, what works for you. And you and your partner can do some things together where you're exploring, where you're having that conversation, that open dialogue, that open communication, saying, yes, babe, that is good. That's perfect. Or, hey, not that. That didn't work for me. And then have open dialogue and make sure you're doing it in a way that you're not shaming somebody. But if you don't have that open communication, your partner cannot read your mind to know what works and what doesn't work. So.
Okay. And so just as an added, I know that you alluded to it earlier that you and your husband, Joseph, do a show together. Do you all talk about that and cover things like that in your show?
Yes, we do. We're kind of slowly easing. I'm in Alabama, and so a lot of my followers are in Alabama. We are the Bible, and I really put that in parentheses, especially these days with all the ugliness going on, but we're the Bible Belt. So talking about intimacy is not a normal thing. So we're trying to ease people into it, especially our men who may have a little bit more ego. But what I remind everybody is that as we mature in age, our bodies change. The blessing is that we have great technology. So we have technology that can help with all of those changes for men and women. So we focus on the hormone pellets that, I do for men and women, as well as our intimacy solutions for men and women. So when you're starting to have those issues, you're having the dryness, it's not getting better with the prevention or with some of the topicals. We have some great solutions at Me Bella Wellness Center for women that include the O shot, that include vaginal rejuvenation, and that also includes something that we call an O-wave. And all three of those things will increase the blood flow to the area, improve the climax, the orgasm, and the desire for intercourse, as well as decrease your leakage of urine and your incontinence, so that you can experience your beauty balance and beliefs, so you can always live well, age beautifully. And that definitely includes intimacy. You cannot have total wellness without adequate intimacy, whether alone or with your partner. I'm just saying.
Thank you so much, Dr. Mia. I think that's so important, the work that you're doing in helping all of us to feel more comfortable about the natural gift that God has given us. So thank you so much for taking your time out to share with us today about helping to keep the V-flower healthy. Thank you for agreeing to come back in October. I cannot wait for that discussion about men's health and the hormone replacement that you do with some of your male patients. If you'll share with us now, Dr. Mia, if you'll let them know what shows it is you have on Facebook and how they can find you.
Yes, so go to Me Bella Health and Wellness on my Facebook page, and we always have everything posted there. We'll do weekly wellness with Dr. Mia, which is for my ladies only, and that is on the second and fourth Saturday of each month. And then we'll do Ageless Intimacy, which includes male and female intimacy, and that's the second and fourth Sunday of every single month. So don't miss out. Come ask your questions. Come get good information. We can all live this life of total wellness, but we don't want to leave out our intimacy. And then the hormone pellets are going to bring that whole total wellness on top of that. So yeah, look for me on Me Bella Health and Wellness. MeBellaWellness.com is my website if you need to have an actual visit.
Okay. Thank you so much, Dr. Mia. I really, really appreciate it. I'm sure that there are a lot of people who appreciate all the information that you shared with us today. Ladies and gentlemen, that's all we have to share with you today. Again, you can follow Dr. Mia and Me Bella Health and Wellness. She is on Facebook. She lives here in Birmingham and practices in the Inverness 280 area. So please look her up, follow her. You will not be disappointed, and you definitely will have a healthy V-flower if you are listening to and following Dr. Mia's advice and recommendations. So thank you so much, Dr. Mia. Guys, you know who I am. I'm Dr. Celeste, your board-certified family medicine physician. I help busy professionals to find healthcare solutions for their acute and chronic medical needs through my concierge medicine program, virtual medicine program, as well as national speaking and COVID-19 testing, which, by the way, we are doing COVID-19 testing in downtown Birmingham tomorrow from 9 until 2. So we'll be servicing the Birmingham area. Same day appointments are available. We'll be there from 9 until 2. Just give us a call and let us know that you're on the way. With all that, ladies and gentlemen, I hope this was helpful for you. I hope that we're going to follow Dr. Mia's great advice on how we can have healthy sex and keep our V-flower healthy.
And make sure y'all check out Dr. Celeste. I send a lot of my patients to her. She takes great care of them. We all still need to do our preventive medicine. We need to see our primary care doctors. Dr. Celeste is absolutely amazing for men and for women. So make sure you are following her and going to see her for your prevention, because you can't enjoy intimacy without your basic wellness and prevention and treatment. So make sure y'all holler at Dr. Celeste. She's the best.
Thank you, Dr. Mia. Thank you so much. Thank you so much for taking time to come on. And we look forward to having you back in October, if not before then, for you to talk about some of the stuff that I won't go into detail with now. And also make sure you follow Dr. Mia for her next event, the Ageless Intimacy Ladies. Just trust me. Trust me.
Don't want to miss it. So Saturday, this coming Saturday, the 11th and the 12th, we will be live. Actually, Joseph is supposed to do my show on the 11th. So it'll be a little bit of everything. So y'all make sure he's going to speak to the women so that we can get that male perspective on Saturday the 11th. And we're going to speak to the men and the women that Sunday the 12th. So y'all get ready. Me Bella Health and Wellness. It's Dr. Mia.
Okay. Thank you so much, Dr. Mia. Guys, have a great Sunday and we will see you later. Have a good day. Thank you so much, Dr. Mia.
Bye, y'all. Thanks for joining. Thanks, Dr. Celeste, for having me.
Thank you.